everyone, and welcome to the Fast Friday feature. Today we have three of us who've deployed on the disaster mental health team for the Red Cross in the past couple of weeks to weigh in on some of these headlines. First, Katherine and Laura, will you briefly introduce yourself and where you're from? And very briefly, what was the best and worst thing about your deployment? Please don't overthink this. I'm thinking about 30 seconds total.
I'm Laura Cardinal. I'm been a social worker for about 15 years, primarily in medical social work. And I am a clinical assistant professor of social work at University of Southern California and live in Washington State. I teach in the virtual program.
Wonderful. Katherine, or Kat, as we call her.
Hi, yeah, I'm Katherine. I've been in the field for about 3.5, 4 years now. I'm a licensed mental health counselor, and I live in Phoenix.
Great. So I'll put you right on the spot and ask you, what was both the best and the worst thing about your deployment, specifically your deployment for Hurricane Harvey?
Okay, so for me, the best would be just being able to interact with everybody, meeting new people, and just feeling like my skill, my trade was really needed there. I could see that what I do and what I did down there was really needed, and I didn't feel like it was wasted. What I didn't like was the waiting, like getting there and waiting an entire day. I just felt like it was wasted time. And I know you have to in process and get everything filled out, but I feel like that could have been a little bit more efficient, and I just hated waiting. I got there at like noon, and I waited till like almost 10 o'clock at night, just there.
Great. Laura.
Yeah, I think honestly, in a nutshell, going and doing something was what was best about it. I think I've been sitting around watching the news on many fronts and looking at things and just started to really feel that I needed to do something. And so getting the orders, getting off that plane, and everything that went after that just felt like this is what I needed personally as a professional. And just as a human being on this planet. And it also felt, like Katherine said, just really rewarding to do the work and to have my skill set be utilized in such dire circumstances. My least favorite, I'm not having that. There's not been much that has come up for me in that regard. I got tired, you know. We had to rough it a little bit here and there, but it was good.
Oh, are you saying you liked us sharing that balcony in the Civic Center?
Yeah.
In our cots?
Yeah.
Yeah, it was good. I actually said that I was really happy that we had that that time in the Civic Center in a staff shelter, which I think it would have been a very different experience had we been in hotels. And it seemed like the impression was a lot of times professionals or doctors, and they bring on medical teams or mental health teams, tend to go to the hotels, at least from, it sounded like what Laura and I were told when we arrived. But I think that our experience would have been a lot different, you know, and as far as being able to spend time with each other and the debriefing, which Laura was so much better at doing than I was. You guys, and the humor was essential. So thanks to both of you for that. So recently a headline came out on NBC News 2 days ago. American Red Cross fails to pay funds promised to many Hurricane Harvey victims. Can you offer any personal insight to this headline? I know we were all there literally at the Beaumont office when this program dropped. And we were out in, we were on different teams. I know the three of us those days, but I know we were in Port Arthur when this was happening and when people were trying to get money at Walmart. So I know we all have our own personal experiences with this. So any personal insight to what clients were going through would be helpful, and just what you see as having happened, because that's what made the headlines as far as cost.
I would say I was in Vader when the program dropped, Vader, Texas, and the difficulty that I saw people have is that, I mean, first it's wonderful, you know, you you hear the news that you can do it. And but not a lot of people had computers or access to the internet. You know, and the response was you can go to the library. Well, people couldn't get to libraries in their area. So it was like this thing that you just can't, you want it, but you can't really get to it. I guess that was frustrating for a lot of people. And, you know, they would tell me like, that's great. Well, how do I do it? And I just had no help there, you know, for that. And it's like, we can't transport thousands of people just to, you know, a library and a lot of people don't have smartphones in those areas. They had regular flip phones. So it was like the dangling carrot, you know, it's like they saw it, but they still couldn't get it. And it was there, but they had no access to it. So it was a little frustrating. And, you know, I'm glad that it was accessible, but it just wasn't accessible to everybody. So people were frustrated.
Yeah, I agree. In the town that I was in, I had been sending people to, you know, referring them to the library for free internet use. And it wasn't until towards the end of the day that I learned that the library wasn't even open in the town that I was in. So there was my own personal feeling of, oh, I've let people down in that way, but I was sort of just doing what I was encouraged to do. And there were so many things that we were calling on to try and make sure places were open or that people could access. And it, you know, it didn't dawn on me to call the library. But yet I was referring people. But also just the overwhelm, you know, like Kat, you said about, I spent most of that day that the program dropped in a sort of a housing complex that was for disabled and older adults. And more often than not, I would say, well, you will need an email address to, you know, and that was like their eyes just glossed over. It was just too much to even think about. Not only like applying online if they even had access, but to create an email account. And it's just, you know, they'd say, well, I'll get my nephew to help me or something like that. But, you know, just seeing the overwhelm, you know, we have to get it out there some way. But I think a lot more people were comfortable with the phone idea. Though that was proving challenging as well, just because of the sheer volume. I think when we look at criticizing the Red Cross for systems being difficult to access and all of that, I think we have to, one thing that for me on the outside before I arrived on ground in Texas was that I could watch the news and I could see the footage of the map and how large of a scale it was impacted. But until I actually got there and saw the sheer magnitude of distance and density of homes and sprawl of homes, like, you know, it became really clear to me that we are not talking about, you know, 100,000 people calling that day for financial assistance. We were talking about a huge volume.
1 million.
I was going to say too, that, you know, one of the messages, it was, you know, I wanted to say to people, you know, try to be patient. They're going to get it fixed. You have time. But as we all knew, the three of us, in talking with people every day, patience is not something that's easy to come by when you need $5 for your copay for your prescription that you haven't had for over a week. So patience, yes, we can say. However, that the reality is that people don't have time to be patient, and that was hard to find my way with.
I agree, and I feel like a lot of our clients they don't necessarily know the difference between FEMA, Red Cross, their insurance company. All they know is really bad things are happening to them, and no one is able to help them in a way immediately that they need. And I feel like the Red Cross tried to jump in and say, at least here's, without a whole bunch of forms, like all the things they have to fill out for FEMA, and the rest of it is really arduous. But they were trying to make this simple $400 for affected families. Do you live in this area? Here's your address. Okay, here's $400. And it did happen that way for a lot of the people who got in first. Like the first 37,000, it was pretty seamless. People went to Walmart by 10 or 11 in the morning and they had it, but that's if they got in before the system crashed. When we had 1 million people trying to access it and then getting error messages, part of the problem was the website, yes, but it was also 1 million people trying to access the same thing over and over and over. And so I didn't realize until some of this was happening, and I was sitting with clients who were asking, can I use your phone? can we try it with your phone? And realize, okay, there's no Wi-Fi. Even if it says there's Wi-Fi, there's no Wi-Fi. And we all know how frustrated we get when it says you have a 1 or 2 bar signal and it won't ring through or it won't connect. And so that was happening as well. So there were infrastructure problems outside of Red Cross's website. It was also just the immediate area couldn't handle all the calls, whether it be on cell phone or internet. And our handful of computers we had in Beaumont, the one time I tried using it, Laura, I know you used it a couple times too, it was worse than dial-up was back in the day. So there were more than just the Red Cross's issue as far as—
And Walmart running out of money?
Yeah, and they didn't, and I don't know how they could better do that, but they didn't. For some of them, they could go to different places to pick up money if they had the right reference number, but a lot of people went to the same Walmart, and so there's only so much money, and Walmart wasn't going to give them money out of their pocket. So when they ran out of money for the day, that was it.
That's it.
And it's frustrating and I don't really know when the criticism rolls around, what is it they expect of Red Cross or the volunteers to do short of standing with $400 cash at our Beaumont office with no security? Like, how would that actually work? And so I think we need to think that through for all the disasters we have coming, if that is something we want to be able to do, or we just have to make it really clear it's not going to happen immediately. It might be more immediate than FEMA, or it might be more immediate than your insurance company, but it's really hard to do anything cash-wise.
Yeah.
Immediately. But you guys might have different ideas. I don't know. But I felt like that was the hardest thing for me, was not being able to give that information. And like Laura said, it might be good information at the moment, but then it changes. Or places get shut down because they realize mold or other unhealthy things. They can't have people in the building. And so then that option is also gone. Okay, one of the mayors in one of the harder hit areas said, if you promise something, you've got to make it happen. Do you feel like it's a reasonable statement in a disaster hit city like the ones that we were in?
Yes, I think the statement is true, but for the situation, I don't think it's realistic. Because yes, I feel like if you promise me something, I expect that. You know what I mean? You have to fulfill your promises.
Mm-hmm.
I think in those kind of situations, as hard as it is, I don't think promises should be made. Because things like houses that we said we were going to hit a certain day, well, the wash was washed out. What if I promised you I will be at your house tomorrow at 5 and your road is washed out and I can't cross it? So I just let you down. You might have been, that might have been your last meal. You're waiting for me. So I think you have to side on that air of caution when you are making these statements, because a lot of times you are, susceptible to the elements, especially in, that one road we went by had a train.
Right.
Train. Do you know what I mean? Now, what if I made you a promise that we would get to your area and now there's a train? You know what I mean? And so I just think you really have to be careful with the words that you're using when it goes with people that need things. We will try our best. We will use all our resources to try to, reach you. But I don't think a promise is realistic, especially when people are still, wading through water and just not having any access to certain roads. I think you just have to be very careful with what you can do, because a lot of times it's not as easy as that. And I wish it was. I wish we could have hit every single house, but it just was not possible, especially some, like there was a river. I have pictures. There's like a river going through the street. And it's like I had all the food in my car and it's like the house is right there. I can see it, but I can't get to it. So it's like I couldn't promise that. All I could do was try my best. And a lot of times I just couldn't, because there were so many obstacles to try to reach them. It just wasn't possible.
Yeah, I remember once there was a mobile home right in the middle of the road. I mean, it just covered the road, highway,
Right.
Highway, and a bed was stuck up against the chain link fence. So
Right.
it's like, you can, just like you said, you can see it, but you can't do what you want to do. And I think that was one of the things they told us at orientation. One of those first days, saying, don't promise to come back the next day. And I feel like that was really hard for me. And I know we all had a couple of cases that were really difficult. And so I would say that is one of the harder parts for me, because it's hard to just leave people hanging, especially if you've met with them and see their need. You're like, okay, I know they need all of these things, so I've got to get back to them. But then you encounter the same kind of need along the way the next day for all of these other people. So how do you decide who needs it most? And I think that this is what people don't see on the other side. They see the headlines and they see little clips of people standing outside their house with lots of stuff out there, but they're not seeing what the workers are doing and trying to organize in their own little tiny worlds every day.
Right.
I know all of us would talk at the end of the day, but there was always something left hanging. Days with resolution were hard to come by. And so then you've got to trust when your wave leaves that the next wave is taking over those places that what do we call those, the hot spots. So there's nothing easy about this. It's worthy, but not easy.
Sorry, I didn't mean to interrupt.
Oh,
I think going back to your original question about, is it fair to promise, or, was there a promise made? And I'd have to do a lot more research to say that anyone said, we promise to give you this on X day. I think that the Red Cross says you have a month to apply for these $400 funds. To me, that doesn't translate to a promise that you will have it within 12 hours of when we open the website. Do I understand why people need it within 12 hours? Absolutely. But I don't know. I think that statement, I get the sentiment of it, and I agree that we have to, if we're going to say we're doing something, we need to deliver. But I don't know that the Red Cross was negligent in not in saying something that they weren't delivering on. I think that the system, and maybe the learning opportunity is when the magnitude is as large as this was, or is, and continues to be, and will continue, is that there's some way of I'm using the word floodgate, but not opening the floodgate all at once, but easing the floodgate, whether that be, it sounds so elementary, but if your last name is A through, B, or A through D today, you apply today, and some system to sort of make it reasonable for the system to manage the volume. And again, that's very elementary, but I'm not sure the Red Cross promised something and then didn't deliver. There is a month, but that, again, the patience is hard to have.
Well, and that's a perfect segue too. And I think that, Laura, what you just pointed out is important for the headline. So I think for headline purposes, the headline was not correct. It was saying that Red Cross failed to pay. But we haven't even got to the October 9th or 10th deadline for them to do anything. And so I think that is an unfair burden on a charity who, even if you can collect all that money for 1 million victims for just one event, you still got to get it out to people. And so the segue really is into overhead. So when we are doing the other part of some of these negative headlines are, well, only X amount, depending on whose report, I won't even go into those. Whoever's report we're talking about says only X amount goes to the actual victims. And so I feel like I got a different perspective, and this is part of the reason I wanted to talk to you, was I got a different perspective once I got in the ground on overhead costs. We kind of know the generic costs, and I knew that they would be covering my travel to get there, even though I'm volunteering my time. But I'm curious to what you two feel about overhead costs and what you experienced while you were there, and what you think is actually necessary for overhead in order to have a good, well-run operation.
I don't think that I saw anything excessive. That I would say, okay, this was not necessary. We didn't need this. I mean, and it's also because we stayed in the staff shelter. We were, all the water, let's just say one person that I was using to brush my teeth because there was no running. We couldn't use the water, to clean up with, to drink. I mean, it was a lot. That was just for the small little mental health group of us, and that was getting us there, plane tickets, getting us back, getting me from the there to the actual Red Cross headquarters. So I think there's a lot that it's like you just don't see. It's that behind the scenes that you see on the TV or the news. You see people working and they're wearing the vests, and you just see them, but you don't see them eating 3 times a day, or them trying to find, following the trucks to eat off the herbs, and you know what I mean, and some of the stuff that I did buy for people, I had a homeless gentleman that wore a 5X. He didn't have any clothes. And that was so hard. Walmart stops at 3X. So I was like in different cities, way out, trying to find him clothes that I bought. So it's like, it's all those little things, driving to and from, the gas, and that's for, like I said, multiple thousands of people every single day. So it's like, I feel like if they were a little bit more transparent about that, maybe it would go through. But I understand that some people have hang-ups about the Red Cross, and there's nothing that's going to change that. And I wish that they could see that the work that we do, and then I understand the cost. Do you know what I mean? Like, just seeing what we're doing, you would think it would, people would understand and kind of go with that. But there's money people, and they want to see where the money's going, and I understand that. I just don't know how you could even start to do that with the amount that we're each, using. I filled up that van so many times, and that was just me. In one day, I'm driving out an hour. I'm driving all over different towns. I'm looking for people in a rental car, going. So it's like, I guess I'm curious of what people want, and if they got that, would it be enough? Is their dislike for the Red Cross stemming from something else, or is it just the money? If they saw where the money went, would that be enough for them? I don't know.
Yeah, and I think Laura had said something earlier about this too. Just the 400, like, if you could just even get the $400 immediately to them, even directly post disaster. Mm-hmm. As we all know, when we were arriving, because we came in behind the helicopters, basically nothing was open. McDonald's wasn't even open the whole time we were there. So even if they had the $400, where were they going to spend it?
Right.
And if we
no
got
hotels available, there were no rental cars in that whole vicinity available, no rooms, nowhere to live. So now everybody has $400 to do what? You can't buy a car with $400. How are you going to get? There's no buses running. So here you are in this mold, water-infested house with $400. Walmart's not open. There's nowhere to get food. So it's like, what are you doing?
These are the things missing. These are the items missing for people that have a lot of things in their head on what would happen. So electronic money is better, is it? Well, I guess it would be to pay maybe your car payment, but what's $400 going to do? Right. Especially when you've got a family. So is that going to really cover anything that you desperately need right now? And the other thing I learned, especially from us all living in a staff shelter together, and I know Laura and I were right next to one of the herb drivers, Rusty, and listening to her talk about some of the stress that she encountered and they work the longest hours of anyone for the most, at least from what I witnessed. And they're out there trying to make sure that they get hot food out to people within a certain amount of time. It's like, okay, we have 400 meals and it has to stay this certain temperature. And after it passes that, we have to throw it out. So it's like, the critics are going to be there no matter what, because you're throwing food out. But at the same time, if we feed people bad food or out of temperature food, we're being, neglectful. And so now that we've seen it firsthand, for me, it's harder to understand some of the criticism because no one really sees all of these pieces working together. And like you both said, we can make promises on where we want to go, and we know, okay, this Rose City, for instance, remember, we've got to get out there. They need, and then something happens, and you can't get to them, and the food, it goes bad, and then we end up throwing out food, and that's upsetting, and it's personally upsetting to the herb drivers who work so hard. And it's a different story staying at a truck and handing food out where people are coming to you versus what they try to do when time's running out. So not enough people have come to the truck because they can't access the truck. So they start packing up the food and taking it to people, which takes a lot more time, which means you can serve far fewer people, which means we need more volunteers. And what was it, day 5 or something, when there weren't enough, you have to have legally two herb drivers per truck in order to serve people. And we needed 8 trucks, but we only had enough herb drivers for 4. So mental health and health went out with herb drivers. And this is the stuff people aren't seeing. So it ended up being good teams, but that was in order to serve twice as many people. And so Red Cross is very flexible as far as within the parameters we have to serve as many people as possible. But there's just no way to answer questions like, how many people, how much is this going to cost, without having a crystal ball. Let's see. Okay, so overhead can be a dirty word when people are choosing what charities they want to donate to. And I was one of those people, for sure, especially in my 20s when donating was a new thing. I wanted to see like 99% goes to the people who really need it, and not really having a sense that overhead is what keeps consistency and quality too. And I think that the Red Cross, more than many others, has more turnover, because I think it's 90% plus, you guys correct me if I'm wrong, volunteer. So there are the paid workers, and I agree with Laura, not spending much time on who's being paid the most and why. For the most part, nobody's being paid for their hours. So where does the overhead go, and what is more important? I felt like when we were there, and you guys please disagree with me, but I felt like they need more paid employees. But I understand they probably don't have more paid employees because it will add to the overhead significantly. And I felt like there was the woman, I don't recall her name at the moment, but she came at the very end to try to harness some of the chaos that was happening over the $400 thing. And sending a paid employee who hasn't been on the ground with the volunteers since the beginning was rough. It was a really tough experience for her. And they need more consistency, but that consistency costs a lot of money. And I don't know how to, I'm just kind of floating that thought out there because I don't know how to best put that out to people who are wanting to donate to an organization that does so much, but it is costly. So where do you think the money should be spent in overhead? In your experience now, you deployed in one of the biggest disasters in history. So where do you think some of that overhead needs to go? I know you've got your own thoughts.
I mean, I think having paid people would be awesome. I mean, that would just be wonderful. Because like I said, a lot of times when people did get there, they just had no idea what was going on. Like, here am I, I'm just a volunteer, and I'm telling you what the area looks like. You should already know this. This is your company, you know, I'm just a volunteer. So I do feel like that, but I think what people have to understand when it comes to that if they want, like you're saying, quality people, then you have to pay for anything. There weren't just, it wasn't just all laborers there. There were, you know, doctors and PhDs and masters and nurses and RNs and like everybody else, we have families, we have, you know, and we have to be paid what we are worth as well. So although I'm willing to volunteer a certain amount of time, if I'm going to be hired, then I need to be hired for what I'm worth. And can the Red Cross really hire that amount of quality people to all be paid what they're worth? And I don't know if I see that with the amount of people that they need. It doesn't seem realistic. And then how long would that job last? Where would I go on the non-disaster time? And I think that's what comes into play too, is am I only going to have a job during a disaster? You know, then I have to look for a job at some other time. So it's, like you said, there's so many little things that people don't think about, because I'm not going to leave a good job just to go, you know, work a job for the Red Cross. And then when the disaster's over, I'm unemployed. That does not work for me, you know? So although I'd be willing to volunteer, I would need compensation for what I'm worth. And could the Red Cross afford as many people as I saw down there? All those professionals? I don't know. I don't see that, you know? I mean, how many just master's level mental health people were there, and PhD level people? I mean, if you're looking at just bottom, not California, I'm talking about like Arizona pay, 50 for everybody, 45 for everybody. There were what, 13 of us?
At the beginning, yeah.
In Beaumont. And Beaumont was a smaller area. Beaumont was one of the smaller towns. So now let's look at Houston, where they had that whole huge room of professionals.
Yeah.
You know, I don't see it. It would be so much on that scale to keep quality people that they're looking for, that they want. And unfortunately, they're relying upon volunteers, and volunteers are going to be whatever you get.
Yeah.
Laura, how do we spend money?
Well, I don't know. I'm not a finance whiz, but I will say that, you know, I'm certainly deploying myself gave me a unique perspective. I think that it's, again, going to the magnitude of this response. And then obviously while we were there, Irma was brewing and then hitting, and, you know, the pull of attention to Irma, while also making sure that the people of Texas feel that the Red Cross is still there and will not be deserting them just because there's a new disaster. It's not a new headline to follow, but knowing that the magnitude of both events occurring at the same time, you know, volunteers are what it's all about. And I think, you know, Kat's talking about the level of professionals. I think that's a missing piece of Red Cross's positive transparency, that it's the Red Cross is providing some dollars on the ground. As you know, at $400 a family doesn't sound like that much when we're having a good month and we make, you know, 400 plus a month, but it is a lot to people who need it right then. But a lot of what the Red Cross is doing is putting professionals and others on the ground that are meeting people's very basic needs of food, shelter, clothing, and some sense of security. And I think that the professionals, you know, that were there, that's not something that you learn about the Red Cross on a day-to-day basis. You think of, like, you see the insignia and you think maybe, you know, a shelter or meals. Right. But the Red Cross is providing, you know, the type of support during a very traumatizing time, that the value of that, if just the three of us spoke to any families with young children, we may have impacted for the positive the long-term trauma effects of the, you know, and we weren't doing therapy. We were just providing a supportive ear in a lot of cases and helping with resources. So I think that when we even look at, if there's critics of saying, well, why are you even paying volunteers to get places? You know, other organizations, it's on the volunteer to pay for their way to go. Well, I would not have been able to do that. I would not have been able to pay my way to get to Texas and try to do the work that I wanted to do. Financially, I wouldn't have been able to do that. And so it made it possible for me to, you know, help there. And I wouldn't have otherwise, if it was with an organization that didn't cover the cost of getting me there. So I'm extremely grateful, and I hope that the people I worked with would see the value in the work that I was doing with them, even if it didn't translate to money in their pocket.
You just pointed out, and we need to wrap up here in a moment, but one thing you pointed out, Laura and Kat both, is that Red Cross covers so many things for a single family, or even just a single person, that what I found when I was trying to refer people to other resources, we did see other groups on the ground there, and some more obvious than others, but I did feel like it was very piecemeal. So someone's providing perhaps food, someone's providing shelter, someone's providing clothing somewhere, and a lot of it was church-based and other things, which was great. But I found myself referring to the same center that had a Red Cross feeding center there because it had everything. And as we pointed out, you can't expect families to go drive all over town to get water here, get bleach there, get clothes there, get some basic food items for their kids there. Diapers are at another place when there's no gas available. I remember the first gas station Laura and I went to fill up, there was no gas.
Right.
So those first days, there wasn't any way to even fill up gas if your car worked, which most people's cars were flooded out. So can you actually get to all of these places that are offering services? And what I did find surprisingly with Red Cross, it wasn't just feeding and sheltering. It was a lot of referrals and the MASH unit they had behind the shelter and healthcare and things like this. So the all-in-one is really important in these critical disaster times because you can't get all of those places. So even if you're a family of means, which we were in some of those middle and upper class neighborhoods, it didn't really matter. It wiped everybody out. No cars, no car. No stores, no store. So, you know, you're hungry. You know, you don't have any clothes. So that the biggest difference that I noticed was, you know, Allstate was running around for the family, the 20% of families that did have flood insurance, which is a different sense of psychology for those who feel like there is help on the way. And so I think as a social worker, I saw that those who already had anything happening before this, it definitely made it worse for them. But I really appreciate you guys talking about this because I don't think they ask enough of the people who actually spend time there. And I was personally unhappy seeing that headline because I don't think that, I know that a lot of NGOs or charity organizations do make mistakes, and I'm sure the Red Cross makes mistakes, or, you know, it's what happens in, you know, large scale organizations and operations like this. But failing to pay people, I don't think was one of the things that happened here. And, you know, the deadline isn't even until October 9th or 10th. So once that happens, let's see how many people we've been able to cover. And I know they've restarted the website. I think they just built a whole other system to start today. So hopefully that $400 will start getting out. The whole point was for that to bridge some of that gap before other things kicked in.
Right.
Try to give some more immediate assistance. But I think Kat's right, and maybe we can't promise immediate anything because there's really no such thing when everything's wiped out.
Yeah, and when you're talking about resources again, who's fixing those computers? You know what I mean? Who's getting that new website up? Who's doing? I mean, that's just all people behind the scenes that you're not, you know, and that's money, and that's money going out again. So, yeah, I am hurt though when I do see the negative headlines, and I understand them, but it just hurts because I think overall, like you're saying, somebody can go get food, and then somebody was with me, you know, crying and telling me what's going on, and then I'm like, hey, what's that on your arm? You should go talk to one of the Red Cross nurses. And I mean, I don't see anybody doing that, you know, all together at once, where you can get so many of your needs met at one location, opposed to just going through getting food and supplies and leaving. We just hit so many people that just needed for somebody to hear them, and then, you know, needed sores to be looked at, and I, you know, I felt like just us. I mean, how many people we reached was just.
Yeah, and I think we could be fearful of negative headlines like this affecting the kind of help we can provide in the next disaster. So if donations go down, that's less people we can reach.
That's right.
Right.
And I think that's the dangerous part of this that has to be addressed is, you know, we understand you want to see transparency and make headlines, but we also have to be responsible in the stories that we tell.
Right.
Thank you, both of you, so much.
Thank you.
I'll be calling on you again.
Sounds good.